Breanna and Amanda, and our video will be a brief introduction on how occupational therapists can screen for memory and color agnosia.
The objectives of this presentation are that the viewer would know and understand what memory screening and color agnosia are and how to screen for them, and also that the viewer would know which client populations you would likely use these screenings on.
First, we will start out with what client population you would likely use these screenings on, and then we will present details about each screening and how to perform it on clients.
The memory screening is part of the mental status screening. The mental status screening gives you a brief assessment of the thought processes and content and insight into a client's state of mind.
The color agnosia screening is part of the perceptual screening. More specifically, color agnosia falls under the category of visual perceptual disorders. Visual perceptual screenings allow the therapist to determine if the patient is having any difficulty with identifying and recognizing familiar objects and people. Impaired visual anatomical structures are ruled out before performing a visual perceptual screening. Conditions such as traumatic brain injury, stroke, Alzheimer's, other types of dementia, and all psychiatric disorders are common conditions that OTs will encounter and may need to perform a memory or color agnosia screening on.
Now let's take a look on memory screening. There are two types of memory that an OT will screen for. They are short-term memory, also known as working memory, and long-term memory. We will start with short-term memory. Short-term memory is the ability to retrieve stored memories that occurred in less than 24 to 48 hours. It is said that one can hold up to 5 to 9 items in their short-term memory at one time. If short-term memory is impaired or lost after brain injury, it is likely that it will remain impaired. Short-term memory is assessed by listing 3 objects to the client. These words can be as simple as pen, watch, and flag. Then you will ask the client to repeat these words back to you to ensure that they heard you correctly. After 5 minutes, you will test their recall of these 3 words again. Note, it is handy to screen for long-term memory during those 5 minutes. After the 5 minutes is up, you will ask the client if they can repeat those 3 words back to you. If they can recall 2 out of 3 with minimal cueing, their short-term memory is said to be intact. Long-term memory is to retrieve events or information that happened more than 48 hours ago. It usually remains intact or returns to people after a brain injury. To screen for long-term memory, you will need assistance from either a family member or access to the client's chart because these answers need to be verified. For example, you will ask the client questions such as, where were you born and raised? How many brothers and sisters do you have? Can you tell me about the jobs you've had in the last 10 years? Make sure the client's answers match to what the family member has said or what has been written in their chart. If they can answer those questions correctly, their long-term memory is intact. Following this presentation, there will be a short video on how to screen for short and long-term memory.
Next, we will review how to screen for color agnosia. Color agnosia refers to the client's inability to recall or recognize the correct colors for specific common objects. There are 2 different assessments that can be performed to screen for color agnosia. The first assessment for color agnosia can be done in a question-answer format without any extra materials needed. Simply ask the client to name the correct color of the common objects that you list for them. For example, you may list the following objects one at a time: an apple, an ocean, a fire engine, a stick of butter, or coffee. For each object, the client will then state the color associated with that object. The second assessment can be done by presenting the client with several objects, 2 of which are incorrectly colored. For instance, you may present the client with several pieces of plastic fruit in which the banana and grapes are incorrectly colored. For example, the banana could be painted blue, and the grapes could be painted pink. You will then ask the client to identify any objects that are not accurately colored. Color agnosia is present if the client is unable to indicate the appropriate colors for the objects that you name, or if they are unable to identify the objects that are incorrectly colored.
Now we will view 2 videos of both of the screenings. We'll start with the memory screening video.
Hi, Breanna. I'm your occupational therapist, Amanda. I've heard recently that you suffered from a stroke, so I'm here to test your memory out.
Okay.
We're going to be looking at your short-term memory and your long-term memory. So for short-term memory, I'm going to say 3 words to you, and then I'm going to have you repeat them back. And then in 5 minutes, I'm going to ask you what those words were. Okay?
All right.
Okay, so the 3 words I want you to remember are pin, watch, and flag. Can you repeat those back?
Pin, watch, and flag.
Great. And then for long-term memory, I understand your brother's out in the lobby and I've gotten a chance to talk to him a little bit. I've asked him these 3 questions about you and he's answered them, so I'll compare the answers you give me to what he said, okay?
Okay.
So the first question is, where were you born and raised?
I was born in Albuquerque, New Mexico, and then we moved pretty much every 4 years all over the United States.
Wow.
So,
Okay.
different states.
Great. That's actually exactly what he said too.
Great.
And how many brothers and sisters do you have?
2 older brothers and no sisters.
Okay. Excellent. And can you tell me about the jobs you've held in the past year?
Let's see. I was a rehab tech for an OT and then a PT, and I've worked in retail for a shoe store, and I've been a babysitter.
Great. Those all check out as well from what your brother said. Okay, so it's been that 5 minutes. Can you repeat those words back to me?
Let's see. Pin, watch, and flag.
Great job. Those are the words I was looking for.
Great.
Next, we will review how to screen for color agnosia.
Hi Amanda, I'm Breanna. I'm your occupational therapist, and I know you've recently suffered a TBI. So today we're just going to double check to make sure you can kind of recall the color of a common object. So we're checking for color agnosia. So first I'm just going to name a common object and have you tell me what color it would usually be.
Okay.
So an apple.
Red or green?
Okay. A banana.
Yellow.
A fire truck.
Red.
Okay. And how about the ocean?
Blue.
Great, that's exactly what we're looking for. Next, to test for color agnosia, we're going to show you some pictures of common objects, and you'll just point out to me which ones look incorrectly colored.
Okay.
Okay, so if you want to go ahead and point out which ones might look wrong to you.
I think these 2 look wrong.
Perfect, that's exactly what we're looking for.
Here is a summary of the information we have covered in our video presentation. First, both of these screenings are appropriate for populations who have suffered head trauma, such as traumatic brain injury, stroke, or Alzheimer's disease.
To screen for memory, both short-term memory and long-term memory need to be evaluated. Short-term memory requires at least 5 minutes to perform. It is important to have the client repeat the 3 words back to you after you've said them to ensure they've heard them correctly. Remember, in this 5 minutes, you can screen for long-term memory. For long-term memory screening, it is helpful to talk with a family member if available because they can add more details than the client's chart can about the questions you ask them.
Also remember that color agnosia can be screened using a simple recall test or through a color recognition assessment. You can use pictures colored incorrectly or a physical object colored incorrectly.
Here are the references that we used for this project. Thank you.